Hi, this is Dr. Victoria Givens, your facial plastic surgeon with Givens Facial Plastic Surgery here in Austin, Texas. And we are going to be talking about the non-surgical or liquid rhinoplasty. It is a very popular procedure these days, but I cannot stress enough the importance of having it done by a trained, board-certified, and licensed professional. As with any of the dermal filler injections, there's always inherent risks, but especially along the nose. The nose is very vascular and very complicated and leans to a higher risk, even with the most experienced injectors. So it's very important to go to someone who knows what they're doing, has done this very frequently, and understands the nasal anatomy. So a little bit about the procedure. What is a liquid rhinoplasty? A liquid rhinoplasty is basically a non-invasive or non-surgical transformation of the nose. How we do this is it's in office, and we use the highest quality dermal fillers to basically allow for camouflaging to change the shape of the nose. What it cannot do is it cannot make the nose smaller per se. I'm going to explain that in a minute. And it cannot improve nasal breathing per se. So when I'm saying it can't make the nose smaller, if you have a large nose that you want made smaller, there's no amount of dermal filler that you're putting in that is going to make it look smaller physically. However, when you camouflage certain things, say a bump of the nose or turn the tip up a little bit, it balances the face more, and so it can give the appearance of a more symmetric and sometimes smaller nose, but the physical nose is not made smaller. And you can understand this by, if you have the shape of your nose and you're adding volume to the nose to create better symmetry with putting a filler in there, you're physically making the nose bigger. But different camouflaging and contouring in different areas can give the overall appearance of a more balanced, symmetric nose that may actually appear a little bit smaller, even though it's physically larger. So the other thing is we are not correcting any nasal obstruction. So anything inside the nose, if you have a deviated septum, if you have a blocked airway, this procedure is not for you. But if you have small deformities or a hump of your nose or irregularities of the nasal tip, you may be a candidate for this procedure. It can be done at any age, and it is also a great way to determine if you like the look that you've gotten with that dermal filler placement. It's a great way to test out if you may want a more permanent fix utilizing a surgical rhinoplasty or a surgical nose job to make things more permanent. Generally, the filler that's placed in the nose can last anywhere between 9 to 12 months. Most people are needing touch-ups around that 1 year period to keep that look of the nose that they so like. So if you're ready to transform your life and your nose, it's time to call me at 737-787-8200 or email the office at office@givensmd.com. Hope to see you soon.